Depression is a common and serious mental health condition that affects millions of people worldwide. It can cause persistent feelings of sadness, hopelessness, loss of interest, and low self-esteem. Depression can also interfere with daily functioning, such as work, school, and relationships. For many people, depression can be treated effectively with antidepressants, psychotherapy, or a combination of both. However, some people may not respond well to these treatments, or may experience a relapse of their symptoms after a period of improvement. This is known as treatment-resistant depression, TRD. What is treatment-resistant depression? Treatment-resistant depression is a term used to describe people with major depressive disorder, MDD, who do not respond adequately to a course of appropriate antidepressant medication within a certain time. Definitions of treatment-resistant depression vary, but generally they require that a person has tried at least 2 different antidepressants from different classes at adequate doses and durations, usually at least 6 to 8 weeks, without significant improvement. Treatment-resistant depression can also include people who have a partial response to antidepressants, but still experience significant symptoms that impair their quality of life, or people who have recurrent episodes of depression despite ongoing treatment. Treatment-resistant depression is not uncommon. Approximately 30% of people who have been diagnosed with MDD and who have tried medications for MDD have treatment-resistant depression. What causes treatment-resistant depression? The exact causes of treatment-resistant depression are not fully understood. Depression itself is a complex condition that involves multiple factors, such as genetics, brain chemistry, environmental stressors, and psychological factors. Treatment-resistant depression may result from a combination of these factors or from other factors that are not yet identified. Some possible factors that may contribute to treatment-resistant depression are chronic stress. Stress can worsen depression and make it more difficult to treat. Stress can also affect the function of the hypothalamic-pituitary-adrenal HPA axis, which is a system that regulates the body's response to stress and influences mood and cognition. Medication interactions. Some medications such as opioids, benzodiazepines, steroids, or beta blockers may interfere with the effectiveness of antidepressants or worsen depression symptoms. Non-medical drugs such as alcohol, nicotine, or illicit substances may also have negative effects on mood and treatment response. Medical conditions. Some physical health conditions, such as thyroid disorders, chronic pain, diabetes, or heart disease, may cause or worsen depression symptoms. These conditions may also affect how the body metabolizes antidepressants or how the brain responds to them. Misdiagnosis. Sometimes people with treatment-resistant depression may actually have a different mental health condition that requires a different approach. For example, bipolar disorder, dysthymia, a mild but chronic form of depression, or personality disorders may be mistaken for MDD or co-occur with it. How is treatment-resistant depression diagnosed? There is no specific test or criteria to diagnose treatment-resistant depression. The diagnosis is usually based on a clinical judgment by a mental health professional who reviews the person's medical history and response to previous treatments. Some steps that may be involved in diagnosing treatment-resistant depression are asking about the type, dose, duration, and adherence of antidepressants that the person has tried in the past. Asking about the use of psychotherapy and its effectiveness in managing depression symptoms. Asking about any life situations or stressors that may be contributing to the person's mood. Reviewing all the medications that the person is taking, including prescription drugs, over-the-counter drugs, herbal supplements, and non-medical drugs. Evaluating the person for any physical health conditions that may affect mood or treatment response. Considering if another mental health condition may better explain the person's symptoms or coexist with MDD. How is treatment-resistant depression treated? There is no one-size-fits-all treatment for treatment-resistant depression. The treatment plan should be tailored to the individual's needs and preferences, and should involve close monitoring and collaboration between the person and their mental health provider. Some possible strategies to treat treatment-resistant depression are giving the current antidepressant more time. Sometimes it may take longer than expected for an antidepressant to work or for side effects to subside. The person may need to continue taking the medication for at least 8 weeks before deciding if it is effective or not. Increasing the dose of the current antidepressant. Some people may benefit from a higher dose of their medication than what is usually prescribed. However, this should only be done under the guidance of a mental health provider, as higher doses may also increase the risk of side effects or toxicity. Switching to a different antidepressant. If the current antidepressant is not working or causing intolerable side effects, the person may need to try a different medication from a different class. For example, if an SSRI, selective serotonin reuptake inhibitor, is not effective, the person may switch to an SNRI, serotonin and norepinephrine reuptake inhibitor, a tricyclic antidepressant, a MAOI, monoamine oxidase inhibitor, or another type of antidepressant. Adding another medication. Sometimes, combining 2 or more antidepressants from different classes may enhance their effectiveness or target different aspects of depression. For example, adding bupropion, mirtazapine, or aripiprazole to an SSRI may improve mood, energy, or motivation. Alternatively, adding a medication that is not an antidepressant but has mood-stabilizing or anti-anxiety properties may also help. For example, adding lithium, lamotrigine, buspirone, or prazosin to an antidepressant may reduce suicidal thoughts, mood swings, anxiety, or nightmares. Trying psychotherapy or talk therapy is an effective treatment for depression that can help the person understand and cope with their emotions, thoughts, and behaviors. Psychotherapy can also address any underlying issues that may contribute to depression, such as trauma, grief, or interpersonal problems. Psychotherapy can be used alone or in combination with antidepressants. Some types of psychotherapy that have been shown to help with treatment-resistant depression are cognitive behavioral therapy, CBT, interpersonal therapy, IPT, and mindfulness-based cognitive therapy, MBCT. Trying brain stimulation therapies. Brain stimulation therapies are procedures that use electrical currents or magnetic fields to stimulate specific areas of the brain that are involved in mood regulation. These therapies are usually reserved for people who have not responded to medications or psychotherapy, or who have severe or life-threatening depression. Some types of brain stimulation therapies that have been approved for treatment-resistant depression are electroconvulsive therapy, ECT, transcranial magnetic stimulation, TMS, and vagus nerve stimulation, VNS. Trying alternative or complementary therapies. Some people may find relief from their depression symptoms by using alternative or complementary therapies that are not part of conventional medicine. These therapies may include acupuncture, yoga, meditation, massage, herbal remedies, or dietary supplements. However, these therapies are not well studied for treatment-resistant depression and may have potential risks or interactions with other treatments. Therefore, they should only be used under the supervision of a mental health provider and after informing them of all the treatments that the person is using. How can I cope with treatment-resistant depression? Living with treatment-resistant depression can be challenging and frustrating. It may feel like nothing works and there is no hope for recovery. However, it is important to remember that treatment-resistant depression is not a permanent condition and that there are options available to help. Some tips to cope with treatment-resistant depression are: seek professional help. The first and most important step is to seek help from a mental health provider who specializes in diagnosing and treating treatment-resistant depression. They can offer guidance and support throughout the treatment process and help the person find the best strategy for them. Be patient and persistent. Finding the right treatment for treatment-resistant depression may take time and trial and error. It is normal to feel discouraged or disappointed if a treatment does not work as expected. However, it is important to keep trying and not give up on finding a solution. Follow the treatment plan. Once a treatment plan is established, it is crucial to follow it as prescribed and monitor its effects. This means taking the medications as directed, attending the psychotherapy sessions regularly, reporting any side effects or changes in symptoms to the provider, and completing any homework assignments or self-care activities. Seek support from others. Having a strong support system can make a big difference in coping with treatment-resistant depression. The person can seek support from family members, friends, peers, support groups, online communities, or other sources of emotional and practical assistance. They can also educate their loved ones about their condition and how they can help them. Take care of yourself. Taking care of one's physical and mental health can also help with managing treatment-resistant depression. This includes getting enough sleep, eating a balanced diet, exercising regularly, avoiding alcohol and drugs, and managing stress levels. Engage in enjoyable activities. Doing things that bring joy, satisfaction, or relaxation can also help with coping with treatment-resistant depression. This may include hobbies, volunteering, socializing, or learning new skills. Even if the person does not feel like doing anything, they can try to do something small and gradually increase their level of engagement. Seek help if suicidal. Treatment-resistant depression can increase the risk of suicidal thoughts and behaviors. If the person or their loved one is thinking about suicide, They should seek immediate help by calling 988 to reach the Suicide and Crisis Lifeline or 911 for emergency services. They can also go to the nearest emergency room or contact their mental health provider. Conclusion: treatment-resistant depression is a challenging condition that affects many people with major depressive disorder. It occurs when standard treatments for depression are not effective or sufficient to improve the person's symptoms and quality of life. However, treatment-resistant depression is not a hopeless situation. There are many options available to treat it, such as switching or adding medications, trying psychotherapy, using brain stimulation therapies, or exploring alternative or complementary therapies. The person should work closely with their mental health provider to find the best strategy for them and follow their treatment plan. They should also seek support from others and take care of themselves to cope with their condition and improve their well-being.